Thank you all for joining us and welcome to our webinar, Healing Communities, the Health Professionals' Role in Environmental and Climate Justice, Resiliency, and Policy. Before we begin, all of us at the Medical Society Consortium on Climate and Health respectfully acknowledge that our advocacy, education, and learning across the country takes place on the occupied and unceded lands of many Native American tribes. To acknowledge this land is to recognize its long history and our place in that history. It is to recognize these lands and waters and their significance for the peoples who lived and continue to live in this country and whose practices and spiritualities were, are, and shall always be tied to the land and the water. Today's webinar is the seventh in our 2024 Climate and Health Equity webinar series as part of the Climate and Health Equity Fellowship Program. The CHEF program recognizes the need for more diversity in climate and health leadership and a sharper focus on equitable climate solutions. The goal of the fellowship is to empower doctors of color from populations that face greater burdens from climate effects and are underrepresented in medicine to become leaders in climate and health equity education, advocacy, and policy solutions. I'm Dr. Shanita Johnson, Director of the Climate and Health Equity Fellowship. Also joining me from the consortium to run this webinar are Dr. Venice Curry, Associate Director of the Climate and Health Equity Fellowship, Dr. Kimberly Williams, Director of Operations and Strategy at the Medical Society Consortium, Dr. Al Glover, Policy Experience and Equity Climate and Health Fellowship Fellow, and Clarissa Payton, Chef Program Assistant. Clarissa will also be available through the chat to answer any technical questions that arise during this webinar. The webinar series is hosted by the Medical Society Consortium on Climate and Health. It is held for 1 hour on the second Friday of each month from 3 to 4 p.m. Eastern Standard Time. Today's webinar will be recorded and made available on our YouTube channel and website for future viewing as part of the Equity Resources page on the consortium's website. This year, we are excited to continue our initiative of offering CME credit for our webinars. Instructions on obtaining credit will be provided at the end of the webinar. When considering the impacts of climate change through the lens of equity, it is vital to understand the dynamics of communities most at risk and the role doctors and healthcare professionals can play in community resilience and ensuring the health of community members. Today, we are honored to have Ms. Dana Johnson, Chief Movement Advisor of Strategic Movement Collective and former Senior Director of Strategy and Federal Policy for We Act, as our speaker. She will provide a policy perspective that includes a strategic federal legislative agenda with a climate and health equity lens that directly and indirectly impacts community members. Rather than using our time to provide a further description of her impressive work, we are placing a link to her bio in the chat. The general format for today's webinar will be one presentation by Ms. Johnson, followed by questions and answers from our audience. We ask that you put comments, links to any resources that you may recommend, or any questions that you may have for the presenter in the chat box at any time during this presentation. We will get to as many of the questions as we can during the Q&A period. Please remember to keep yourself muted so we are not interrupted by background noise. And Ms. Johnson, please begin.
All right. Thank you so much for having me today. I will get my presentation up here. All right, there we go. So I thought it could be a little bit helpful before I go into my presentation to just talk a little bit about my my background. So as was mentioned, I spent the past 5.5 years or so leading the Federal Policy Office for We Act for Environmental Justice. So one of the prominent environmental justice organizations in the country. And our work was divided up into what I think are 3 different buckets. We had advocacy work that was really focused on raising awareness broadly around environmental justice issues and the policy agenda that we set for ourselves, but also at We Act, we in our federal policy office served as a convener of environmental justice organizations across the country called the Environmental Justice Leadership Forum. So we really were working to make a federal connection to the work that people were doing on the ground in their communities. There was a policy aspect of the work that we did, primarily in Congress. So really looking at policies that were coming out of the legislative branch, and in some instances, making recommendations to ensure that we had legislation that would, focus on things like equal protection, indoor air quality in communities, ways to reduce emissions from the siting of or exposure, I guess, public health exposure to pollution from the siting of facilities in communities. But also like the regulatory environment. And I think I talked about that a little bit the first time that I had the benefit of speaking to a larger segment of this body around the regulatory work that we were doing to reduce pollution exposure from the transportation and the power sectors. And then is the communications part. So how are we building a national, a federal narrative around the issues that were important to environmental justice communities and using all of the tools that were available to help humanize and put a face on the issues that we were working to address. And that wasn't a place that I expected to end up in. I actually have my background is in marketing. So I have an undergrad degree in marketing, and I actually thought I would be running organizations. So I have an MBA and with a focus on operations. But I found myself always being in spaces where it was important to ensure that people living in a community of color, primarily, but oftentimes areas of low income as well, were visible, were seen, and had a seat at tables where decisions were being made about various aspects of their lives. And so when I think about the environmental and climate justice work that I do, there is a little bit of that marketing part that comes in for me. So it's the Maslow's hierarchy of need, which, sort of outlines the stages, the phases that people go through as they work to get to self-actualization. But the first three areas I feel like are those spaces where we have worked in my environmental justice life. I know it can be expansive for others, but people's psychological need at the very foundation of our existence. We don't want to be hungry. We don't want to be sick. We don't want to have people be in places that are overheated, or they're experiencing extreme weather events. We want people to be safe, and that safety comes in the built environment. It comes in, safety in terms of mobility and transportation, safety in terms of what's in their environment. And then like that social aspect of people coming together to solve environmental injustices, to build climate resiliency in their communities, which, in many ways look very much like the social determinants of health, those things that ensure that people are healthy and have a positive, thriving quality of life. And in both of these instances, and thinking about the role that a physician has in this space, oftentimes you are the first to see people in spaces of, being exhausted or experiencing extreme heat, or being sick or in pain, etc. And so there is a role, I think, for physicians in helping us to articulate what is being experienced in communities as a result of, climate change, climate injustice, environmental injustices that can span the gamut. It can, we're talking a lot more now about, echoic anxiety, like those symptoms that people come into spaces with because of the fear they have around climate change, or the the physical ailments that people come into those symptoms, and really being intentional about being able to identify like patterns in those symptoms that may speak to larger issues happening in communities. So when we think about environments, when we think about environmental justice, we are oftentimes talking about more than just that, initial foundational definition that relates to conservation. We're talking about the places where people live, they work, they play, they pray, where people learn. And they were also talking about the physical body as the environment. And that is the ethos that we bring to the work. But also in Washington, D.C., it has been what we have tried to get members of Congress, people in the administration, to ensure that we keep that in front of people, that they have that understanding. Which also leads to the places or the spaces where we have focused our work. So clean air programs, as I mentioned, looking at the regulatory environment. The past 3 years, we have focused on the Environmental Protection Agency's clean air rules, so the National Ambient Air Quality Standards, as well as the 111B and D, those that focus on power plants, and really thinking about how we can reduce pollution exposure, but also really be supported in the compliance part of that, the enforcement, the oversight of the application of those rules in communities. We've done a lot of work around healthy homes, and this continues to be a big body of work, building electrification, and how we can make the living space, the indoor air space in housing, and for us specifically, it's been affordable and public housing, much more safer for communities. So my colleagues in New York City recently wrapped up a study. We called it Out of Gas In with Justice, and it looked at the health benefits of reducing pollution exposure that comes from gas appliances, and how that might improve someone's cardiovascular health, which led to a bigger body of work for us at the federal level that was much more foundational in how do we look at the whole of an electrification process. So how do we think about energy efficiency? How do we think about toxic remediation? And as the forerunners to decarbonizing a home. And we did a study with Physicians for Social Responsibility and the Sierra Club that looked at the benefits of improving the indoor air quality in buildings, and how that might lead to much greater health outcomes for people living in affordable and public housing. And we're continuing to see this be a really important space for advocacy at the federal, at the national level. And there are always opportunities for expert voices to come, into that space and be supportive of the work that's happening there. And I'll just say, like, sustainable land use, affordable, equitable transit is really important to people. Water quality was a big issue that we worked on. And this for us at the federal level was really important during COVID-19 because CDC guidelines called for something as simple as washing hands. And in some communities, because of the outsourcing of like the water systems, if people had their water shut off because of a bill, so an affordability issue, it impacted their ability to be able to comply with CDC guidelines. So it was really important for us to use, medical voices in that kind of advocacy as we work to even expand the temporary funding. So it was a water version of like the low income heat assistance program, LIHEAP, for a short period of time to help people with their water bills to, as an advocacy point. Energy and climate justice work, toxic-free products, again, thinking about the body as a space where considered to be an environment, exposure to waste and pesticides, and then open and green spaces is another place that we worked in. What is happening? So from an environmental justice perspective, when thinking about how we define this work, for us, EJ is the fair treatment and meaningful involvement of all people, regardless of race, color, or origin, in the implementation and enforcement of environmental laws and regulations, as well as policies. And I think one of the things that we continue to contend with now that I think, physician, the medical community's intervention can be vitally important in is the enforcement part. I am right now working on a project where I am working to understand the policy priorities of environmental justice communities and what's the next body of work that we should focus on. And people repeatedly push back on something new and really are calling for the enforcement of existing laws and regulations that we have on the books. And it's raised a lot of questions around, how are we capturing that kind of information? What kind of partnerships can we have to support enforcement? How is that data being shared? And how are we leveraging it to use to influence policy? So what I thought I would do is share with you a tool that right before I left WEACT, we worked on that tried to bring all of those pieces together as a way to support communities in the enforcement process. So interestingly enough, 2 years ago, during the Congressional Black Caucus meeting, annual meeting that they have, I was walking through the convention hall and looking at the energy and environment programs. And there were 24 programs on the agenda, and all of them were sponsored by 7 different sponsors from the oil and gas industry. And so when you think about the impact of fossil fuel infrastructure and operations on communities, it did not serve us well to have a body that oftentimes has representation or is the representative of communities having its annual conference sponsored by industry. And so at the same time, the American Lung Association had come out with its annual State of the Air report. And so I thought with our team that we could make a comparison between Congressional Black Caucus, Congressional Hispanic Caucus, membership, the grades that were received by their districts in that American Lung Association report, look at where these members of Congress were getting their funding from. And as I mentioned earlier, we convened that network of environmental justice organizations. And so look to see if this member of Congress had someone from our network in their communities. And that would be the basis of a report that could have, many more indexes added into it, public health indexes to help it to serve as an advocacy tool. So what the team came up with is what you see here. As I mentioned, this is for React for Environmental Justice's district. This is a website. It's a GIS tool that our research team developed. And as I mentioned, we can always go in and add different data points to help us tell stories. So even if you thought about like data that you captured in your work, in your communities, those kinds of things could be added to this report. But it has like the congressional members district. It, it does tell us what political party they belong to. But it also looks at the ozone breakdown in their community based off of that report and the grade that they received. So this particular district has a grade of D because of the industrial facilities that are cited there. It gives us a breakdown of its PM grade. And as many of you probably know, during the COVID-19 pandemic, anyone who had a consistent exposure to PM 2.5 and contracted the COVID-19 pandemic had a higher mortality rate than someone who did not. And so our ability to be able to, tell that kind of health story when we're talking to members of Congress would be extremely important. We wanted to look at what percentage of residents are people of color living in that district who were exposed to extremely poor air quality. And then we also wanted to look at that percentage. So how many residents in that district, and in this case, 84%, live in a community where for ozone, you have a grade of a D or an F. And, we even looked at how is this particular member of Congress supporting key environmental justice legislation. So at the federal level, we are doing an amazing amount of work around the Environmental Justice for All Act. It's a comprehensive piece of legislation that was curated by having, in this instance, Representative Rahul Grijalva from Arizona and the late A. Donald McEachin from Virginia travel around the country and go into communities and look at the environmental injustice challenges there, but also talk with people about solutions. So in this bill, you even see investment for research projects that can support, air quality studies. I mentioned those toxic studies, those beauty toxic studies. So anything that impacts the body, those kinds of research projects can be supported from funding through that kind of legislation. And so it's become a really big, important tool that we hope to have passed in the next couple of sessions of Congress. I think we're starting over with that. And then it looks at other things like how the League of Conservation Voters tracks how members of Congress vote on bills. And so you can see like this particular member of Congress, 99% of the time will be on the right side of voting for bills that are important. But like, this is the kind of tool that I think, when I think about the work that you all do and, the people that you see, the research that you might be involved in, those are the kinds of data gathers that we see being really important for incorporating in tools like these, because they empower communities to have a much more substantive, robust, data driven conversation with legislators and other policymakers and practice makers for that matter, and helps to move the needle a little bit further. So I'm
Are we on
not
the same floor?
sure of where I am with time right now, but I wanted to plan for a 15-minute conversation, and I can conclude here.
Great. Thank you so much for such an insightful presentation and the work that you're doing. There were some questions that were placed in the chat, and if you have additional questions, please go ahead and place them in the chat or raise your hand. So I'll go to the first one. Are there any ideas how we can educate patients about climate change in their office visits?
Yeah, so I think what we see a lot, and that goes back to like that Maslow's hierarchy of need, we have to focus foundationally on where people are. So to have a conversation in a doctor's office about climate change might not be the place to start with someone who is, contending with, asthma or, poor respiratory health conditions. It might not be the place to start with someone who, when you think about like hunger, like getting your basic food needs met. But there can be a connection drawn to having a person become more aware about the environment around them. So thinking about, remember reading a study about, I think it was in Lancet actually, African Americans and Hispanics and their proximity to industrial facilities and how that impacted their mental health, how it impacted their economics, and how it impacted their physical, their respiratory health. But it was related also to like people's awareness of those factors. So, like asthma is not correct, like it shouldn't be one of those things that is what's the word, like an heirloom. Like you should not pass that down from generation to generation. At some point, we need to have conversation around why is it that, everyone in a family is having this condition, and draw their attention to what might be in their environment, indoor and outdoor, that's contributing to that. I'm going to drop this, the aired out report. I'm sorry, not the aired out report, but the buildings report that I think I saw in the chat.
Yes, a copy of the study for clean air in homes.
Mm-hmm.
Any other questions from the audience? Dr. Keel said that was her district that you reviewed.
Oh, it is?
Yeah, I
Yeah.
live here in Harlem, on 148 between 7th and 8th. I recognize the Mother Claire Hell's depot. Yeah, I recognize so many of those pictures.
Yes. Here it is. It's called the National Buildings Report.
Okay.
I thought the 2 was excellent.
I know, I love it. I can't wait for it to come out. It's much more than I anticipated it could be. But it gives us so much great opportunity. Before I left tested it with a couple of congressional offices, and for them to have a visual presentation of what's happening in their district felt like it shifted the needle a little bit.
When will it be out? Do you have any idea?
Yeah, I don't know. Was supposed to come out this summer. I'll drop a link to it if you want to look at it.
What are the barriers like in my mind? I'm trying to, it's such a good thing. Like
Yeah, I think it's internal.
okay.
React for change. Just resolving some things internally to be sure that okay. Okay, here it is. It's
A lot of times the holdup is getting access to credible data. How are you able to do that and to form the partnerships for this tool?
so, and for this particular tool, we did not develop any of the data on our own. We curated what other entities had already done, and we were in partnership with them to develop it. But I will say, We Act for Environmental Justice does have a really robust history, especially in Northern Manhattan with Columbia University, to be co-owners of data and research projects to look at, various public health, challenges facing the community. And you see that happening a lot more across the board. One of the panels or convenings that I was able to participate in earlier this year was focused on how communities and research institutions, particularly those in academia, can have much more robust partnerships that start with, communities casting a hypothesis that the research institution and communities can work together to examine and explore. And I think you see a lot of desire to continue to do that kind of thing.
Couple more questions. Is the tool comprehensive for the entire country?
So this is looking at congressional districts across the country, only on the House side. Just the way that the Senate works, you have your 2 representatives that represent the whole state. So this is broken out by congressional districts on the House side, but it is inclusive of the entire country.
Wonderful. Are there consideration of integrating tools that can share this type of information into the electronic health records so clinicians can easily access this data?
I think that question is one that's beyond what I even knew to be an opportunity or a possibility for us. But we were always thinking about how we could add more data sets in. So, how could we add in the EPA's, EJ screen into the tool? There is a climate and economic justice screening tool that the White House Council on Environmental Quality put out at the beginning of the Biden administration. So we were thinking about how can we add that kind of tool in. And so, any other data sets that are available are possibilities. The team set up the model, the framework. And so it's just having access to a new data set and they can go from there.
Great. Well, are there any last questions before we close out? And I know, Ms. Johnson, you'll spend some time directly with the fellows after this webinar, but if we have any last questions for Ms. Johnson before we close the webinar, this has been exciting to see where you're moving in this space. Okay. So I'd like to thank Ms. Johnson for her work and for speaking with us today on this webinar, and thank you all for participating in our webinar series. I hope that you found it useful. As a reminder, these webinars are held on the second Friday of the month, and our next is on October 11th at this same time, and the topic will be mental health. Before you leave, we ask you to take a moment to complete the webinar survey if you haven't already, and the link is in the chat. As announced at the start of the webinar, we are pleased to offer CME credit for our webinars this year. To claim this credit, please follow the link in the chat or scan the QR code on the screen and follow the directions on our website. Today's activity code to claim CME credit is 13335. 13335. And this now concludes our session. I hope you have a wonderful day and a great weekend.